Welcome to the seventh Personalized Surgery podcast. Today, we are privileged to have Dr. Rajiv Shah, a renowned foot and ankle surgeon from MS University Baroda. He has done fellowship in US, Spain, Japan, Germany, France, and South Korea. He's one of the first one to establish foot and ankle fellowship in the country, as well as has served as a president of Indian Foot and Ankle Society. He's also one of the leadership members as part of the Asia Pacific Foot and Ankle Council. Welcome, Dr. Rajiv Shah.
Thank you.
So, tell us, how did you got inspired to take up foot and ankle as a specialty?
Oh, it's really a story. See, while I did my MBBS and Master of Surgery in Orthopedics from Baroda Medical College, I had least exposure to two things. One was spine surgery and second was foot and ankle. I did not realize that I had less exposure to foot and ankle surgery. But one fine day while I was in a practice, some of my fellow came to me and asked that, Rajiv sir, who does good foot and ankle surgery in this country? And I was speechless. So I immediately answered that you do. You are the one who do this good foot and ankle surgery. He said, no, you're joking. But I think there are no good doctors who do good foot and ankle surgery. And based on to that, I decided that yes, this is the area which is worth exploring. This is the area which is most neglected specialty of the orthopedics. And then time, it was not an established specialty of orthopedics. It was recognized as one of the most neglected specialty among the doctors, among the patients, among our teachers, among society at large.
Wow.
And I thought that this is a specialty which is worth exploring to really serve mankind of India.
Amazing. So often you hear that foot and ankle is actually much harder than hip and knee, right? What are some of the nuances in foot and ankle that requires a more precision, like that play a bigger role, if you can share?
See, if you talk about the function of foot and ankle, the function is locomotion. We can only control our diseases nicely if our foot and ankle are okay. Many times problems of the hip and knee are recognized by the transfer or the referral pain to the foot and ankle. So, if you do not have the good health of your foot and ankle, you're going to suffer a lot with health of your body. The most important thing if you talk about foot and ankle is that it has got 25% of body bones are located in the foot and ankle. It has got 110 ligaments. It has got so many joints. So it's a complex architecture where every bone, a small bone, is lying by the side of the other bone, and any disturbance into one bone can disturb so many other bones and joints. So that's why it makes it complex vis-a-vis hip surgery, knee surgery. And obviously the biomechanics of the foot and ankle are very, very complex. They are the ones which drive us to walk, to move forward in an upright manner in the society. So that's how the foot and ankle, because of its unique function of locomotion, gait becomes a very, very important part of the body. You're not dealing with one joint like hip or knee. You're dealing with multiple joints, 27 bones, 33 joints, 110 ligaments.
Crazy. Talking about 3D technology, you are one of the early adapters of 3D technology in foot and ankle. I remember like 6 years ago, you have had one of the early total talus replacements. What used to happen before, and if you can share a little bit more about what has changed after that.
So I guess I went into 3D printing not before 6 years, but I think before 8 years.
Okay.
The 3D printing is a breakthrough technology for trauma, deformity, and bone loss. These three things. And if you talk about any orthopedic problem, the more of any field, may it be hip, may it be knee, may it be shoulder, may it be elbow, may it be foot and ankle, the biggest challenges are posed by trauma, bone loss, a very bad injury and patient comes with a bone loss or some infection, bone is gone. So loss of bone, trauma and deformity. Now talking about trauma, the kind of trauma which we get in our setup, they are very complex trauma because of road traffic accidents, because of falls. The systems are still evolving, so they are very common. Talking about bone loss, the biggest problem today to solve in orthopedics is the loss of bone. And loss of bone I have seen was being treated with amputations. You cut the limb and compensate for the loss of bone. So that's second thing. And the third thing is deformity. India being leader in third world countries, we have lot of foot and ankle deformities. We say that poliomyelitis is eradicated, but the residual deformity of the poliomyelitis are quite rampant, and we see them quite often. They are very much daunting, very much challenging to look and to really plan for the surgery. So deformities, I mean, wherever I go into the world, whenever they invite me, they always ask me to talk on to deformities. May it be polio deformity, may it be complex post-traumatic deformity. So deformity correction is one of the most important thing we do, and today I do in foot and ankle orthopedics. So in every area, so far as country like India is concerned, so far as the Asia Pacific countries are concerned, we have most challenging thing in front of is correction of deformity. Now, talking to how 3D printing has changed the way we used to think, the change we used to work, change the way we now treat our cases. Now, talking about complex trauma, in a complex trauma, we need customized implants. Some trauma is very close to the joint. Some trauma is involving the joint. And when this complex trauma is associated with the bone loss, the situation becomes very much challenging. And there, by 3D printing, if we can produce a lost bone, by 3D printing, if we can produce a customized implant which is specific to that patient, many times what we have noticed in our practice that the implant and instruments they have made, implants are made in the Western countries and then they are sent here or we use them. Our bones, our body habitat is absolutely different than the Western one. The kind of implants which they use may not fit into our scenario. So customizing implants for our patient, customizing implants for a complex traumatic case is what 3D printing has helped. Coming to the bone loss, maybe we will talk it later, but deformity is one point which I started with when I went into the technology, 3D printing technology. So deformities used to be so complex that you really do not have an idea, and patients are so much neglecting their deformity. Many times they don't have resources to come down to you, they don't have knowledge that this deformity can be corrected. They are disheartened by most of the doctors to whom they go. They say, no, there is no solution to this, you have to live with this.
Yeah.
So that makes the deformity very much complex, challenging, daunting. And such cases, when the 3D printing technology came, I started getting a 3D printed model of a deformed ankle and foot. When I started practicing or rehearsing the surgery before surgery. So the cases, you get a 3D printed model and then you analyze the model and then you realize, oh, these are the places where I'll have to do osteotomy or scientifically cut the bone and realign the bone. So a rehearsal of surgery is being done 2 days prior to the surgery, which makes your life easy, which gives you a swift, clear-cut correction, and patient is also benefited by reduction of the operation time and precision into the reduction, and precision into the correction of the deformity. So my 2 year since we met, my 2 years journey was into deformity correction. And would you imagine that those days we had labs in Pune
Right.
and lab in Mumbai, and to make them understand, I had to travel to Pune, and then I had to make them understand that what I really want, what
Right.
material you need to give, so that I can cut the material, I can fix it with the wires and all this thing. So it was very much challenging, and because the technology was not so commonly seen in this country, they used to charge very very heavily, and ultimately this patient, it is going to be on the shoulder of the patient. So that's how my journey of I mean, this 3D printed implants and instrumentation started way ahead, before
Amazing.
I ventured into 3D printed total
Amazing.
talus.
Amazing. So on the trauma, so you said that trauma, deformity corrections, and bone loss, where you really don't have any solution. That's where this kind of technologies really help. Uh, Coming to the trauma and the total talar as a solution for trauma, maybe if you're probably one of the only surgeons who have done the highest number of cases for total talar replacements. If you can share a little bit more about what are some of the indications of these patients, and how is it different from, say, other anatomy and disease?
It's a great point you made, and it takes me back to my first case of total talus replacement. There was a guy who was driving a motorcycle, and he was from scheduled tribe community into those areas, those forests of this areas, and then he met with some accident. It was a very bad accident, and he had multiple long bone fractures, and he also had a wound over the ankle and foot. And when he was brought to us, we had, as usual, we always focus to the major injuries and we neglect foot and ankle. So we started his surgery, and at the end of the day, when we all were tired, and then that time I had to look at his ankle and foot, and there was a big wound here. Through that wound, the talus bone came out. It extruded out. Now, if you talk about the talus, talus is such a vital bone.
Yeah.
It has got articulation one joint above. That's our ankle joint, which is taking 33% of significance so far as the lower limb is concerned. And then below it is a bone where a joint forms, and you move your ankle and foot like this into through this joint. So it's an inversion eversion movement. Below, it's an dorsiflexion plantarflexion movement above. So that makes a talus fracture, talus injury very unique. So this guy had lost his talus, and then it was an open wound. So I put in some wires and frame and all this thing, and the area of that lost talus I bridged with a bone cement, and then it was destined that I'm going to fuse the joint. So whenever talus is lost, a bad talar injury is there, or sometimes talar dies because of loss of blood supply, the only option till date we had was like we need to fix this joint, fix this joint, and then this fusion will not allow any movement to the patient, and patient is disabled. He walks with the disability, he loses his normal gait, he really finds difficulty into doing his routine activities. Mind you, these are the patients, they are the bread earners of the family. So it's a huge loss to the family.
Yeah.
Now, this tribal young guy, I told them that there is no other option except we will fix your ankle and subtalar joint, and you won't be able to move. You may not be able to drive motorcycle henceforth. And they was really disheartened. Now, here comes the important part of the story. 3 days down the line, relatives came. They found out that extruded bone from the road. and they brought that bone in a bag and some cloth and all these things. It was quite dirty. They brought it,
Right.
and they said, "Doctor, you brought this. Please put it back into the
Wow.
body." And I was like, "This cannot be put in," and they were very much disheartened. I could read from their face that they were struggling
Yeah.
to find that bone out from 2 days. There were like 6, 7 family members who were searching that bone. And after 2, 3 days, they could search out that bone and then brought into the cloth and all this thing. And I said, though this cannot be used, this will have to be thrown out. I was also taken aback. I was also thinking that how best can I do something uh, to this patient. And obviously, Japanese have done their experiments with their engineers. They have made a ceramic talar replacements, and they had proven it with the studies of 30 to 50 years. And so I thought, let me do something with this. So we cleansed the talus, we rinsed it, but still it was not worth using because there was mud, there was dirt, roadside injury, and it extruded and it
Yeah.
went into the bad areas of farms and all this thing. So then I thought that let me get the CT scan of this talus. So I got a CT scan of that talus, and out of that I said, let us make a 3D printed total talus replacement. Now for that I had to go, I had to travel twice or thrice to Mumbai. The people were young into this technology. They had this 3D printer, they had never done this. And then I had to do a lot of discussions with them, 3 visits to Mumbai, and then we came up with 10% reduced size of the model. And then I had some few holes, I had a extractor and impactor. This is what I designed. I said this is how I would want. The irony was that it was a very costly affair for that tribal young man. And I said, anyway, he's not going to spend for this talus, but it was only one size. So it reminded me that there was a match between India and Pakistan, and there was a last ball, either you hit 6 or you get out of the match. So that's how was the situation. Only one single size. I reduced the model size to 10% and then I put in. And fortunately, with God's grace and everything going well, it is now 7 years that his talus is survived. And then one fine day, you met me, and so like my wife, I also asked you where were you this many years, and then we started our journey of talus replacement. And if you recollect, whatever talus replacements has happened in this country, you and me were almost always involved, and it was really, the journey was great pleasure. Journey was with a great pleasure. You see, we got 2 total talus replacements done online, and I was sitting on my computer, and then my fellow was doing the total talus replacement. Now, so that is the beauty of this. But the bottom line is that you can prevent amputation. You can give a good life mobility to the patient. That is the eventual essential beauty of total talus replacement. While I was talking last year to somebody in US who also has been doing this lot of 3D printing total talus, and when I shared my numbers, all of them they said that you probably have the maximum number of single center series about total talus replacement in the world. So that's a pleasure.
That's amazing. So, how are those patients? If you can share, like, because they might be coming back after say 2 years, 3 years follow up and all. Like, what are some of the challenges that you have faced over this years, where you feel like where is the next version or next future of this you think could go?
So let me answer the first question. Yes, these patients are told that they need to meet me at least once a year. and get connected to me at every 6 months. Majority of them are doing very good. They're very happy that their moments are preserved. Their life is mobile. Many of them, they send me the pictures. So one of the guys sent me a picture when he got engaged, and that same day on that motorcycle he took his wife to be, and he was driving and he asked her to take the picture and sent me the video. So like patients are very happy. Patients are very happy, and they're progressing well. Touch wood, 7 years still the total talus replacement is surviving. But at the same time, I had my set of failure where I was poor in selecting the case. So sometimes post-traumatic situation, you should be very, very much watchful for case selection. If you select a case which has got lot of deformity and you try to do everything together, that may not work. The deformity correction, so far as it's a very bad deformity, you will have to do it first and then you have to do total talus as a second procedure. This is what I have learned out of my failure of one case where I could not put my talus inside. I had to keep it out, and very soon I had to remove it and I had to do the fusion. The beauty of this procedure is that whenever it doesn't work, you have a fusion to your hand. The answering your second question, yes, it is surviving. We really do not know how many years it will survive, because the latest study which has come, that of Dr. Celine Parekh, he has shown survivorship of 5 years for 3D printed total talus replacement. Now, anything coming or appearing into the research journal will take another 2 years. So by that time, your numbers might have increased or the survivorship might have increased. So I am seeing my cases which I did in 7 years back. There were 3 cases, one for trauma and 2 for avascular necrosis of talus. All of them are surviving. What I have noticed is they got, all of them, they got good dorsiflexion, plantarflexion, but few of them have restriction into inversion and eversion. So that is one thing which is expected. That patients may not get complete inversion and eversion. Rest all activities they do fantastically. Mind you must tell your patient that this is not meant for you to go and play cricket. This is not meant for contact sports. You could play some light sports, non-contact sports, but it is not meant for contact sports. So indications, as you ask, are trauma, traumatic loss, malunion, non-union of the talus, avascular necrosis of the talus, or any condition which brings in a loss of talus, like cases in tumor. If I had to do one in a patient who had a big chondroblastoma of the talus. So there it is an indicated for total talus replacement.
Awesome. Great. Very inspiring. So, like 10 years from now, where do you see these technology helping in particular in foot and ankle? And you mentioned that there are 110 ligaments, and we see that while the bone is an easier part, the in the soft tissue and the ligament is where the real challenges happen. Like, what's your vision? Where do you see it?
You're right, absolutely right. The bone is a very kind of tissue which, when it gets repaired, it gets repaired with the original tissues. While other tissues like ligaments and soft tissues, when they heal with the fibrosis. So it's not an original kind of a tissue. 10 years down the line, I see a great future of 3D printing technology. 3D printing technology would come into patients with patient-specific instrumentation, and this technology would be so much popular that every orthopedic surgeon will have to be familiar with 3D printing technology. And the indication of 3D printing technology is no limit. Whatever you can imagine, 3D printing can get. So it's your imagination which is the indication for 3D printing technology. 10 years down the line, I foresee, if you talk about 3D printed talus, that when the ankle joint gets degenerated, because that's a natural bone surface going articulating with an artificial titanium bone surface, uh, maybe we can do a customized 3D printed ankle replacement over the top of total talus replacement. There are cases which are being done in the Western world. Uh, the early reports are encouraging, but still, long-term study are to be evaluated. So patients are treated again in Japan also they are doing it. Total talus replacement TAR over TTR, total ankle replacement over total talus replacement. The another important advancement which would become very common would be PEK material, PEKK. You know that material very well, which is radiolucent. So when you implanted your implant and you take an X-ray, you don't see anything. But the longevity, the metal interface, the material quality, everything would be very good. I don't know what will be the cost implication of material, but that could be the future of 3D printing technology.
Awesome, great, very inspiring. Vision and patient outcome as really a focus is really critical. If you have to give like one advice to the young orthopedic surgeons who wants to pursue, say, foot and ankle as one of the specialties, what would that be?
उसको देखा उसको चाहा उसको पाया देखते ही देखते वो खुदा बन गए. So for me, when I looked at foot and ankle, I really loved it. I was into prayers for foot and ankle. I lived foot and ankle, and I think today it has become my God. To the young orthopedic surgeons, I feel if you are looking at becoming foot and ankle specialists, it is the specialty of orthopedics. And this specialty has got everything under its umbrella. You look at the verticals which foot and ankle orthopedics has. It has trauma, it has deformities, it has arthritis, it has congenital problems, it has pediatric foot and ankle orthopedics, it has diabetic foot in it, it has got arthroscopy and endoscopy, it has got percutaneous surgeries, it has got arthroplasty. Every other gamut of orthopedic surgery is under the umbrella of foot and ankle. So it's a branch which really one would love to be into. Today, I have noticed that maximum number of orthopedic surgeons are interested into foot and ankle orthopedics, probably because they have now realized the significance of this specialty. And second, it is the most aggressively emerging specialty of orthopedics, where you have every gamut of orthopedics under your umbrella. And one advice, if you want me, to give you, I would give two advices, one professional, one personal. So professional advice would be disciplined. Whichever specialty you select, be disciplined, learn it by heart, practice it by heart, analyze your results, innovate and experiment, and come to serve the society with a full enthusiasm. And one of the personal advices which I have been giving to every fellow of mine is, look, medicine is a changing science. And there are multiple modalities available to treat one particular ailment. You could do nailing, you could do plating, you could do wiring, you could do frame fixation for one particular thing. And there are situations where you are really fought with a puzzle that what to do. Do I do plating? Do I do nailing? Do I do this? Think at that particular time, if this patient happens to be my near and dear one, what I would do. Whatever voice comes from the inner heart, follow that, you will always be successful. And that essentially is the empathy which we should be practicing. That essentially would be the difference in the years to come between us, human being, and AI. That is what we are here to give.
Amazing. So we'll end this session with a one quick rapid fire round. One surgical innovation you are most impressed about.
3D printing.
One common misconceptions patient have about foot and ankle surgery.
The condition they have cannot be treated, nor there is any treatment for the condition they suffer with.
One technology every foot and ankle surgeon should have access to.
3D printing.
One problem you want to solve in foot and ankle.
Ignorance.
One innovation you're most excited about to see that as a routine in next 10 years.
Weight bearing CT together with weight bearing access.
Fusion or replacement, which one do you think will evolve?
Replacement, only replacement, patient specific instrumentation, and 3D printed replacement.
Awesome. Thank you so much. Thank you, Dr. Rajiv Shah, for giving us time and being part of our personalized surgery podcast. We really appreciate you being here and giving us this, kind words. Thank you so much.
Thank you. Thank you. Thank you.